Can you describe a time when you had to deal with a difficult customer? This is one of the most frequently asked questions in pharmacy interviews, and it's vital to prepare for it thoroughly. The hiring manager wants to understand how you respond under pressure and resolve customer-related challenges. As a pharmacist, how you manage customer interactions reflects your professionalism, emotional intelligence, and communication skills. In this video, we will explain how to approach and answer this interview question, provide a sample response, and share a real-life scenario to reinforce your understanding. By the end of this video, you'll be able to structure your response confidently, avoid common pitfalls, and clearly highlight the strengths that interviewers are looking for. The following are guidelines on how to approach this question. Employers ask this question to assess your conflict resolution skills, communication ability, and emotional control in challenging customer interactions. They expect a professional, solution-focused approach that keeps patient safety and satisfaction in mind. You should demonstrate empathy, problem-solving, and resilience. Avoid saying things like, "I told them off," or "the customer was wrong and I made that clear," as these show a lack of professionalism and poor conflict handling. Also, avoid sounding defensive, blaming others, or dismissing the customer's concerns. Instead, focus on active listening, staying calm, and offering practical solutions. These show emotional intelligence, leadership, and customer-centered care. Your response should highlight the situation briefly, your role, the actions you took, and the outcome. If you follow these steps, you'll deliver a compelling and professional answer that impresses the interview panel. Finally, knowledge of professional standards and codes of conduct, such as those set by pharmacy councils or national regulatory bodies, is essential, as they guide appropriate pharmacist behavior during customer interactions. Taking into consideration the guidelines given above, here is an example of how you can respond to this question. One time, a customer became very upset when I explained that we couldn't dispense their controlled medication without a valid prescription. They had recently moved to the area and were unfamiliar with local pharmacy regulations, which added to their frustration. I remained calm and empathetic, acknowledging how distressing it can be to be without needed medication. I explained the legal and clinical reasons behind the policy, reassuring them that it was for their safety and protection. To help resolve the issue quickly, I offered to call their GP and request an emergency prescription on their behalf. After a short wait, the prescription was sent electronically, and I was able to dispense the medicine. The customer thanked me for my patience and professionalism, and it reinforced how clear communication and empathy can help diffuse a tense situation and maintain trust. In conclusion, preparing a clear and empathetic response to this question shows your ability to maintain professionalism under pressure. Practice your answer using these steps, and you'll be one step closer to securing your pharmacy role.